the answers you want or you need from one specialist, get a second opinion, get a third opinion. Don't let anyone tell you, like if you love to run, if you love to cycle, if you love whatever that you love to do, that you can't do it because there may be a solution. And the first person you saw may not be versed enough in your condition to give you the proper solution. So don't ever be afraid to get a second opinion and ask questions because it's your body and it's your life and you should do what you love to do.
Welcome to Running is Cheaper Than Therapy podcast. I am your host, Dr. Weta L. Brown. I inspire and promote movement. I explain how running adds to life from a mental wholeness aspect, how obstacles can be overcome in life to make it to your finish line.
Welcome to Running is Cheaper Than Therapy, episode 32. Today I'm going to talk about a very common runner's injury. It's called runner's knee. I've had runner's knee before on a couple of occasions. And what runner's knee is patellofermoral syndrome or anterior knee pain. It can be caused by a number of reasons. And depending on the particular reason will determine the treatment. I had runner's knee amongst other overuse injuries. Anyone who knows me or who has listened to my podcast, and if you listen, thank you so much for listening. And if you're new to listening, welcome. I've had a plethora of injuries related to running, and my most recent injury was related to skiing. I had surgery. That I've had some runner's knee following the surgery during my 6 months of rehab. So I'll tell you about the instance I had it when I lived in Philadelphia, where I first started running. I used to run 3 to 4 days a week. A group run, did a solo run, and then Saturdays was a long run. And I used to run with a group called United Nations, and Uche, who was on the podcast, was the leader of United Nations. And I credit him to help making me a distance runner. So I used to run with the group, again, 3 times a week, and I used to run by myself as well. And I also did strength training at the gym. Strength training is very important as a runner. I now know that more than ever since I've been running for 10 years. And again, with the plethora of injuries, I realize how important strength training is. So I was training for a half marathon in New York, I believe. It wasn't the New York half, but it was one of their smaller races with the New York road runners. And I really wanted to get a personal best. So I was running a lot. I still was doing my strength training, but I started going to spin classes because I realized the high intensity of the spin class helped increase my endurance. And that endurance helped me run faster and longer. So I used to do a significant amount of spin classes, too many. Spin classes are great, but the class I went to had a lot of up and down and a lot of riding off the saddle, and that puts a lot of pressure on your knees. And I guess my knees didn't like that extra pressure, and I had an overuse injury, which most of my injuries have been because I'm type A plus, and I don't really know how to sit down and rest and recover very well. And I've learned over the years that it does not promote longevity, which is why I've had so many injuries. So I was doing my spin classes and enjoying it, but then I realized that it hurt to run, particularly hills, because hills put a lot of pressure on your knees, particularly going down. So I had to shut down and not run, and I had to basically cancel my race because it hurt too much to run. So I was sad because I really was looking forward to racing at the time, and I still do. I love to travel for races and for bike rides. It's fun having vacation or trip surrounding an activity. those are the most fun for me. So I was excited to go to New York. I was living in Philadelphia at the time. So I was going to go up on the train, race, and spend the weekend, see some friends. So I was depressed and sad. So my group, United Nations, actually, this is my only experience with obstacle course race. And I always tell my friend Lonnie, who has a podcast called Black with Endurance. And if you haven't listened to her podcast, her and Coach Solomon, please do. It's called Black with Endurance. Lonnie Woods. Both of them are into obstacle course racing. And she's always trying to talk me into doing a race. So my first experience was when I was shut down because of my runner's knee. I went to an obstacle course race. And I remember the obstacles, the mud, jumping over things. I just sat and watched. And at the end of the race, Uche had mud in his teeth. And I was like, oh my goodness, I work out. I don't mind sweating, but I don't like mud. So I don't know if I could do it. That was my thought. And then after they raced, they claimed to have a shower, and the shower was a water hose. So after the mud in the racing, I have mud all over me and I can't get it off. Especially think about mud in your hair and it dries. It's hard to get out, I'm sure. So that turned me off to obstacle course racing. But I've learned recently that you can obstacle course race and not have events that are in the mud. So maybe I may try it, but I'm clumsy as well. And I don't want to injure myself and not be able to do my other sports that I love. So that was my first experience with obstacle course races when I was shut down from my runner's knee. Again, runner's knee is patellofermoral pain. And patella is your kneecap, femoral is your thigh bone. And where they articulate is the patellofermoral joint. It's common in runners, but it's not isolated to runners. Cyclists get it, people who walk a lot, people who jump and do sports related to jumping, soccer, basketball. And runner's knee is more common in women, particularly women in middle age, which I guess that's me. People who are overweight are especially prone to this disorder. And part of the reason is your knee sees 10 times your body weight. So if your knee has increased pressure, and if you're overweight, you have increased pressure on your knees. So, and with women, they have a higher Q angle, and the Q angle is a measurement from your knee to your hip. And women have a wider pelvis for childbearing. So it makes their Q angle greater than men. So, and a higher Q angle makes you more prone to having patellofermoral knee pain symptoms. Some of the symptoms of runner's knee: dull aching pain around or behind the kneecap or the patella. And you can feel pain with walking, climbing stairs, or descending stairs. It really hurts more actually going down the stairs. Squatting, particularly if you don't have proper form. Running hills, again, going down is usually worse. Speed drills are particularly bothersome. Sitting, because you're bending your knee and getting up from, particularly if you're sitting in a low surface. Sitting for a long time with your knee bent can also aggravate it. Some people also get this popping or grinding sensation under their knee. What causes it? It could be a number of reasons. Overuse. I talked about my instance with the spin bike. That was an overuse injury. Trauma to your kneecap. You fall skiing. You get kicked in the knee playing soccer. You fall playing basketball. You're in a car accident and your knee hits the dashboard. You're clumsy like me. And you hit your knee against the wall or some other object. That can aggravate your kneecap. Malalignment of your kneecap. So your kneecap and your femur or your thigh bone, they articulate in what's called the trochlea, or it's a groove. And sometimes your kneecap does not articulate in the proper path, or doesn't stay in the groove. It may track laterally or to the outside, or track medial or to the inside. And if it doesn't track correctly, that can cause aggravation as well. If you dislocate your kneecap, in an accident and injure the supporting structures around your knee and make your kneecap unstable. That can cause runner's knee. When you're flat feet, you put extra pressure on your knee. Anything that puts extra pressure or causes extra weight on that kneecap can cause runner's knee. Weak or tight thigh muscles or quadriceps can be a cause of runner's knee. After I had surgery in December of 2020, following a ski accident, I had a chondral injury or a cartilage injury. I had a meniscus tear, and I had a partial avulsion, or like where the anterior cruciate ligament or the ACL attaches on the femur or the thigh bone. Part of it came off of the bone. I didn't have to have a complete ACL reconstruction, but I had to get it repaired with a screw. So I had to wear a brace, and I couldn't put my full weight on my knee for 4 weeks. So my thigh or my quadriceps, the muscle atrophied and got weak. So when I progressed in therapy, I had to do muscles to strengthen my quadriceps. It took a long time for my quadriceps to wake up. And in the process of me trying to just even walk or do more functional activities, due to the weakness of my thigh muscles, it put extra pressure on my kneecap, and that caused runner's knee or patellofermoral syndrome as well. That was my main problem initially with therapy after surgery. Another cause is inadequate stretching before exercise. So if you have tight muscles, and most people have tight muscles, most people sit down with their hips flexed or bent and their knees as well. And then those muscles get tight and they get in those positions. So it's to stretch before you work out. But when you stretch before you work out, you should do some type of dynamic stretching. And after you work out, you should do static stretching. This will help in the prevention of runner's knee. Arthritis, if you have a cartilage injury or degeneration of your cartilage, particularly where your knee articulates with the femur, that can cause pain. If you have history of a broken patella or fractured patella, oftentimes after you have a fracture, you get arthritis in the joint or degenerative changes, and that can cause knee pain. Like syndrome, which is a lining of the joint that becomes thickened and inflamed, and this can cause anterior knee pain.
Season 2, I will start a new series called Ask the Doc. If you have questions related to musculoskeletal injuries or musculoskeletal health, please send me a voicemail. Go to my website at www.weouilove.com. Click on the tab Voicemail, leave your voicemail, and select messages will be aired and answered on the segment. Now, back to the episode.
Treatment. So the treatment is based on what's the cause. So overuse. Treatment would be to either modify activity or stop activity. So in my case, I stopped doing spin classes altogether. Some time off, did some strengthening exercises, and gradually got back into running, and my knee pain went away. Also, to kind of calm things down, what's called a show parts brace, which is a strap you put at the end of your kneecap, that can help stabilize, or a brace can help stabilize your kneecap in order to prevent that pain. If you have trauma to your kneecap, if it's a contusion or a bruise, sometimes you just need to rest and let that calm down. Anti-inflammatories, if you don't have any problems with your stomach, and you can take ibuprofen, Aleve. If you can't, there's Tylenol. And then there's topical medication called Voltaren. I use it a lot. It is an anti-inflammatory medicine, but it's in a topical form. You just rub on your leg. That seems to work for me because I have stomach irritation and I can't take the typical Aleve ibuprofen because it causes me a stomach. But it's interesting, even though this is topical medication, if I use it too much, I still get stomach irritation because it's absorbed in your bloodstream, even though it's a topical agent. So if you have malalignment of your kneecap, if it's small, maybe bracing may help, but that may be a condition where you require surgery. A lateral release, or you basically need a what's called a fulcrum procedure, where you realign your kneecap. If you have a dislocation of your kneecap, you may injure what's called your medial patellofermoral ligament, and this may need to be reconstruction. So if you have flat feet, oftentimes orthotic is recommended. Off the shelf orthotic, I like super feet. You can go into a running store and pick the type of orthotics, and it's cheaper because most orthotics are pretty expensive and a lot of insurance don't cover it. So I would start with an off the shelf super feet is fine to see if it helps with your symptoms, or even just going from a neutral shoe to a stability shoe might give you a little bit of support that may help your knees. Because even though it's knee pain, your body is a chain. And if it's one part that's broken in this chain, it can affect the whole system. So if your knees hurt, that's why it's always important to go see a specialist. It could be your feet, it could be your hip, it could be related to your back. Oftentimes, when I was a fellow, we did a lot of research on pitchers. Although pitchers may have elbow and shoulder pain, it may be due to mechanics in their hips causing the issue. So it's important to look at everything, not just one particular joint if you're having pain. If you have weak thigh muscles or quadriceps, strengthening those muscles. But you also want to make sure that you stretch and make sure that your quadriceps is your front thigh bone, and then you have your hamstrings in the back. Your hamstrings could be weak as well, or they could be out of balance. That's why therapy is so important, whether it's a physical therapist, a chiropractor, a functional medicine doctor, because it's not just your muscles weak, it's how it functions in regards to the other muscles around that joint. So it's important that you have someone well versed in that concept. If it's problems with stretching, dynamic stretching before, stretching afterwards, yoga is wonderful because you basically stretch your whole body. So practicing yoga a couple times a week, formal or on your own, may help with your anterior knee pain. Arthritis, if you do have arthritis, there are different ways to treat arthritis. Medications sometimes help. Again, Aleve, ibuprofen, my topical medication, Voltaren. There are certain injections, cortisone injection, there are hyaluronic acid injections, platelet-rich plasma injection. I've talked about these before on a podcast in detail. These may help with some of your symptoms. Even sometimes bracing helps too. When I mentioned the show parts and the neoprene braces, they may help. A fractured kneecap, usually that condition causes arthritis in the joint. And again, those same treatments I mentioned for arthritis. And even with arthritis and all these other conditions, sometimes losing weight, because again, your knee sees 10 times your body weight. So if you just lose 5 pounds, that's 50 pounds less pressure on your joint. Also, KT tape helps. And it's not that it aligns or really gives you much support, it's the proprioception. So when I first started running and I had my anterior knee pain, my therapist used to take me and it really helped. And I still do it now. My knee is maybe 95% better, but it's still a little weak compared to my other side. And I demand a lot of it because I'm trying to get back into training mode. So the tape helps, and they have different colors. So sometimes I even match it with my clothes, or I'll get some weird camouflage tape just to be different. And sometimes some people have knee pain, and it's really, again, it's important to look at other joints. It may be originating in your back. You may have a pinched nerve, and it radiates and causes pain in your anterior leg and your knee. It might not be isolated. Runner's knee, it could be related to something else. So it's important, if you're having pain for a prolonged period of time, to see a specialist. And if you're not getting the answers you want or you need from one specialist, get a second opinion, get a third opinion. Don't let anyone tell you, like if you love to run, if you love to cycle, if you love whatever that you love to do, that you can't do it because there may be a solution. And the first person you saw may not be versed enough in your condition to give you the proper solution. So don't ever be afraid to get a second opinion and ask questions, because it's your body and it's your life, and you should do what you love to do. So out of all of my injuries, this is kind of minor compared to the other ones. if you have any particular questions regarding runner's knee, if you have runner's knee, I would love to hear from you. Send me a message on social media. I'm on Instagram, Facebook, LinkedIn, or you can send a message via my blog, or if you go on my blog or my webpage, you can actually leave a voice message and I'll respond. So thank you for listening. Hopefully you haven't had the injury bug at least as long as I have. If you have, don't despair, because I can't even name all the injuries I've had off the top of my head now, but I've had a plethora. I've had 2 surgeries, 1 procedure. I'm still recovering from my last surgery. And I've had some other injuries kind of related to that kinetic chain, like one thing is off. So I've learned a lot about my body, and I just like to share with other people and let other people know that just because you have an injury, just because you may have to shut down or you may have to modify activities, don't let it deter you from getting back out there. Even if it's not the way you could do things before, but don't let it stop something that you're passionate about and something that feeds your spirit.
That wraps up this episode of Running is Cheaper Than Therapy podcast. Thank you for tuning in. If you already haven't, please download Running is Cheaper Than Therapy podcast on Apple, Spotify, or however you listen to your favorite podcast. If you have any questions, concerns, or possible show topics, please email runningischeaperthantherapy, OLB, Omaha Love Brown. Again, that's runningischeaperthantherapy, Omaha Love Brown @gmail.com. I also can be reached via Instagram, Facebook, Twitter, LinkedIn, and YouTube. Handle We Life, We Love. OUI Life, OUI Love. Thank you, and please tune in again.